Tres. Hi, my name is María Belén Villalta Tapia. My topic is, what are common risk factors for ankle sprains in adult athletes? Definition. An ankle sprain is an injury that occurs when you bend, twist your ankle in a strange way. This can stretch or tear the thought bands of tissue ligaments that help hold the ankle bones together.
And the talus connects to the rest of the foot. They are also connected by these ropes, which are also known as ligaments, that connect the bones together. That gives us stability as well as motion that's necessary for walking.
Twist inward or roll your foot under, and the ligaments can be stretched or torn, a classic ankle sprain. Most will heal on their own.
However, when you have a major sprain, instability can be a problem down the road, and that can lead to often cartilage injury as well as arthritis and pain.
Foot and ankle surgeon Dr. Glenn Schuer says if pain persists more than a few days, see a doctor. His top prevention tips: be more aware of foot placement on uneven ground. Be active and build strength for better foot control. And no matter your activity, don't skip your warm-up.
Stretching often conditions us and prepares us for athletic events such as running, jogging, changing directions. We really need to keep ourselves limber, if you will.
For the Mayo Clinic News Network, I'm Dennis Doda.
Application in physical therapy. Exercise is used as a therapy in the prevention and rehabilitation of traumatic or surgical injuries of the locomotor system. However, factors such as an individual's level of physical conditioning, initiation in stretch and movement exercises, protection of soft tissues, and patient education in the treatment plan. Systematic and safe planning of the trainer to avoid overload of muscles and tendon fibers.
Ankle sprains are among the most common injuries to the lower extremity. These are a result of a fall or misstep during ambulation and sporting-related episodes. This injury is classically observed as an inversion injury at the ankle and subtalar joint of the foot, whereby several structures may be injured. The anterior talofibular ligament rupture is seen with the positive anterior drawer sign in the lateral radiographic view, whereby the talus will protrude from the ankle joint. Likewise, an injury to the calcaneal fibular ligament will result in a positive talar tilt seen between the alignment of the tibial plafond and the talar dome.
Pros and cons. Pros. Proprioception exercises help prevent injuries and improve your sports performance. Strengthening of the periarticular muscles to develop joint stability. It's important to consider at this stage the support of the functional bandage in order to generate a greater degree of security and joint cohesion for the development of the athlete's confidence. Cons: chronic ankle pain, chronic instability of the ankle joint, arthritis in the ankle joint.
Hi, my name is Brian Meinberg with the San Antonio Orthopedic Group and the head athletic trainer for your San Antonio Scorpions. Today I'm going to show you how to tape an ankle and why we would do this and with what kind of tape. First, we start with having the athlete dorsiflex their ankle, putting their foot in a position where their toes are towards the nose. That locks the ankle in position. We're going to use what we call pre-wrap. This is actually to protect the skin. It's not necessary, but it's good for comfort. We're placing the pre-wrap on the place where the tape is going to go on the skin. Next step, we use a white athletic tape as the main part of the tape job, starting at the top with 2 anchor strips. We put an anchor strip at the bottom. And then we use, these are the key components of the tape job, is the anchors. This gives us the lateral and medial support that we need. We do 3 of those. We also use what we call horseshoes. Much like a horseshoe, they go around that part of the ankle. That's we use to lock it in. These next steps is called the figure 8s or heel locks. And this is actually the crux of the tape job. It locks everything into place. Now with soccer players, Specifically, we use a lighter tape because of the mobility issue of them moving back and forth laterally up and down, and it's a little bit more comfortable for them. In other sports like football and basketball, we use all white tape like this. But in cases for soccer, especially with the Scorpions, we like to use a lighter tape. And sometimes we even use a lighter tape, what we call Coban, which comes in these packages. They choose this because it's very light. And the reason why we tape an ankle is to give that ankle some support, especially if they've had a previous injury. A lot of soccer players who haven't had an injury still like to tape their ankles to give them support so they have a little more comfort because of the shoes they wear. They don't give a lot of ankle support like basketball cleats, basketball shoes or football cleats. For more information on this and any other sports-related topics, visit us online at tsaog.com.
Issue applied in Ecuador. At the Central University of Ecuador, an investigation was carried out in which it was determined that the risk factors for injuries in weekend soccer athletes of the Quito's colonial neighborhood language are internal, such as physical condition, time warm-up and stretching, physical overstation, and external risk factors such as the use of incomplete clothing, since most use only shin guards.
Even if you do not lead an active lifestyle, you might sprain a joint at any point in time. As the ankle is the most commonly sprained joint of the body, let's look at how to render basic first aid to it. Treatment of sprains is simple. All you need to remember is a simple bowl of rice. Why rice? It stands for rest, ice, compression, and elevate. Rest the joint if you are in the middle of a workout. Stop putting pressure on the affected area. If you choose to ignore the sprain, you will risk permanent damage. Ice the affected area. Do this as soon as possible to help limit the swelling after an injury. Remember, do not apply ice directly onto your skin and try to wrap it with a towel first. Compress the affected area. A crepe bandage from your first aid kit will work very well for this. Elevate the joint. If possible, try to raise the affected area above your heart. This helps to prevent and limit swelling. This process can be done 4 to 8 times a day and up to 2 days after the injury. Do also note that you should only ice the sprain area for up to 20 minutes at a time. Get medical assistance if you experience any of the following. Develop redness or red streaks that spread out of the injured area, or if the area has been injured for several times before.
Conclusion. The risk factors in sports injuries should be well known by sports physiotherapists, who from sports physiotherapy and as a part of a multidisciplinary team of an elite team or not, since this information can allow them an effective treatment and mainly implement measures and preventive programs. And it's possible to reduce the rate of injuries in a season, which translates into a more competitive team with better performance and athletes with better health.
Following an ankle injury, a strengthening program should be undertaken to restore the full strength and help prevent future injury. Gentle ankle strengthening exercises can be started early with the intensity gradually increased. Seated calf raises are an ideal place to start. In a seated position, lift the heels up as high as possible. This works the calf muscles and specifically the soleus. Resistance bands are ideal for strengthening all of the muscles around the ankle. To work the calf muscles, wrap the band around the foot with the ends held near the body. Point the foot away from the body against resistance. To strengthen the shin muscles, the ends of the band should be held or attached away from the body. The foot is then pulled up against the resistance. To further progress calf strengthening, calf raises can be used. They can be started on the floor with both feet, lifting the heels off the ground. This is progressed to single leg exercises and then performing the same exercise on a step as shown. Following an ankle sprain, inversion or eversion movements should initially be avoided as they are most commonly involved in the injury. These are sideways movements of the ankle. Once pain-free to do so, strengthening these muscles can begin. Using chair legs to act as resistance against eversion or inversion movement, push against them for 10 seconds, rest, then repeat. A progression from this involves using a resistance band to strengthen the muscles. Hold the band to the inside of the foot and turn the foot outwards against the resistance to strengthen the everters. To strengthen the inverters, move the band to the outside and turn the foot in against the resistance. Finally, functional exercises such as toe walking can be used to strengthen the ankle in ways which mimic activities we may perform in our daily lives.